Morning, Elevation Health friends and family. Dr. Dave Yachter here. We have an exciting episode for you today. We're going to be talking about anti-aging absolutes. So I have a little bit of a slideshow I'm going to take you through here with some information here that I think you'll find very, very useful and very practical. So I'm going to go ahead and share my screen and hopefully everybody can see what you're looking at here. First and foremost, starting with posture. Studies definitely show a correlation with posture and the elderly. We know for a fact that people with poor posture do not live as long as people with good posture, and the life expectancy correlated with people with poor posture is significantly shortened. So it's obviously behooves us to make sure that we're doing everything we can from that standpoint in practicing good posture. Also making sure that we have good, healthy habits that support good posture. So the first thing I want to mention is you may see some of these pictures here. You see somebody getting into their car, and this man's getting into his car with his right leg going in first. So I want to talk to you as far as do's and don'ts, and this is something that you want to avoid doing, because when you put your foot in like that first and then you drop down on your butt, basically you have very little support and strength from your legs to stop that force that's being generated when you drop into the seat. Physics goes something like force equals mass times acceleration. So the mass of your body weight times how fast it's dropping into that seat is equal to the force that's generated going up and through your spine. So if you especially have a lower back condition and you're getting into your car with one leg first and then dropping into your seat, that's not a good recipe for healthy healing. So you want to first and foremost put your butt down first in the seat and then swivel and get your legs under the dashboard. And that's the best way to do that. Another thing that we tend to see is people like to talk with a phone between their ears and their shoulder, whether you're doing the dishes or working from home or ironing or what have you. It's just not a good idea, because to hold that phone there, you're using the neck muscles all on one side for an extended period of time, and it causes those neck muscles to go into spasm. And that could easily accelerate the problem in terms of any type of postural distortion that we see with a flexion distortion or a head shift. So some of you know that we're working on correcting these issues, and this is something important to be aware of to try to avoid. The solution would be obviously to get a wired headset or Bluetooth, or just something to make sure that your head and neck stay in line with the rest of your spine. Women who carry purses, if you look at that picture, you'll see that you have to elevate the shoulder on one side to stop the purse from falling off. And again, you're recruiting muscles unilaterally or on one side of the spine and not the other. And it's the same thing as lifting weights. If you have two dumbbells and you're only doing curls with one arm, which arm is going to build the muscle? And so there we create a typical postural distortion, because when you're a woman and you have a purse and you wear the purse, you carry that purse on the same side pretty much all of your life. And that plays into some of the postural distortions that we see that, again, we're trying to correct. So the first thing to do to fix that is to unload the purse first and foremost. I've seen some of these purses weigh 10, 15 pounds. No kidding, no lie. It really is crazy with some of the things that I've seen. Make the purse as light as possible, something that you can actually carry in your hand. And that would be the first recommendation. For men, what I'll typically see is them wearing a wallet in their back pocket. That is a big no-no. So if you wear your wallet in your back pocket, take that out. I don't see too many people doing that anymore. I used to see a lot more of that. People are really more aware of that now. But instead of the wallet now, we stick the phone back there. Again, not a good idea. So put things in your front pocket, and don't forget to remove them when you lay face down on the adjusting table, because we don't want to get a poor reading when we're doing our analysis, trying to find out where you need to be adjusted. That tends to throw everything off. Of course, sitting at a computer all day, all these things, you want to raise your monitor up. Make sure that if you're sitting in front of a screen or a monitor, You want to make sure that your eyeballs are dead center with the middle of the screen, not the top of the screen, the middle of the screen, so that you're looking up to some degree, just as I'm doing with you right now. So just a couple of quick tips on posture. And again, the better your posture is, the lower your risk of early death. This is what medical studies have shown for decades, more than a half a century. Sleeping the right way versus sleeping the wrong way. If you are having problems with your neck or your back and you're sleeping on your stomach, that's making it worse. So that's the first thing I want to say. I know nobody wants to make their condition worse, but if you want to try to correct this problem and help me help you, again, it's important that you're doing your part and I'm doing my part. We're doing everything that we can to speed up the healing. It's going to be a big challenge if you continue to sleep on your stomach. So try sleeping on your side. As the picture shows, put a pillow between your knees, a small pillow. And a pillow for your neck is going to be different from person to person. If you're a larger person and you have a bigger space between your shoulder and your ear, you're going to need a bigger pillow. If you're a smaller person and you have a smaller space between your shoulder and your ear, you're going to need a smaller pillow. The key is to make sure that your head and neck are in line with the rest of your spine. Make sure that your neck is not kinking down or the pillow is too big, making your neck kink up. So you could sleep on one side or the other. And then if you're not comfortable sleeping on your side, sleep on your back. But again, make sure that you have a small pillow when doing that. So it's important that during this process of correcting the cause of your problem, we are restoring the normal structure to your spine. You have to have the curves in your spine. Otherwise, your spine is weakened and it goes into a state of degeneration. So the curves are critical. There are 3 curves in your spine. You have a curve in your neck, a curve in your mid back, and a curve in your lower back. And the ideal curves should be at or near 40 degrees. As you can see in this model, babies are born with some of the curve in the neck, but the rest of it tends to develop when they start to crawl, and as well as the lumbar spine. So when you're putting a baby in a walker too early and not allowing them to crawl long enough and then stand up on their own, they don't have the strength in their lower back or their neck to be able to support their weight under gravity. That's why it's important to let them develop naturally. So everything in nature, when you look at architecture and structures like the Eiffel Tower, you can see the base there, or the Hoover Dam, the strongest arcs in nature have a curve in them. And that's why it's important to do your home care to restore the normal arcs and curves in your neck, your mid back, your lower back. Everything that we're doing here and that you're doing at home is designed to help us restore this as much as possible, as quickly as possible. Many of you have significant degenerative disc disease or degenerative changes in your spine. You'll never get back to 100%. So it's even more critical that you're doing this because of the negative momentum. The most important thing, if you're one of these people, is to stop the degeneration as quickly as possible. It's like trying to grab a hold of a freight train that's moving with significant inertia and momentum. Trying to grab hold of it and just slow it down is one thing, let alone pull it into reverse. So it's even more important, especially if you have degenerative disc disease, to make sure that you are diligent and consistent with your home care. Younger people, even if they don't have degenerative disc disease, are still prone to losing the curve. Look at this study, which shows how babies lose the curve in their neck coming through the birth process. There was a German medical doctor, Dr. Gutmann. He published this in a medical journal. And he said that after studying 1,000 infants, they discovered that trauma to the upper cervical spine caused many health problems beginning in childhood due to lowered resistance to disease. They found by realigning the neck, they were able to eliminate these conditions of lowered resistance. So what you're seeing here is pictures of delivery where they're using the head and the neck to pull the baby out of a C-section or out of a vaginal birth. And when you do that, you pull the curve out of the baby's neck, and you're also sucking the brainstem down into the bony canal, which injures the brainstem. That injury actually weakens the immune system because the immune system response is largely controlled neurologically from this area. Many of you remember Christopher Reeves, who broke his neck. He was paralyzed. This is the area that he damaged. And he didn't die from paralysis. He died from chronic upper respiratory infections because his immune system was so compromised. So this is why it's absolutely critical. If you want your children and your family to be as healthy as possible, stay out of doctor's offices, off medication, out of hospitals. You're really at a disadvantage if you're not having them checked, your children and your family members, on a regular basis, because this is where it starts. Here's a 7-year-old girl who came to our office, and you can see that picture on the left there, and you can see she was developing a scoliosis. And this 7-year-old girl, she didn't have any back pain at the time. Her mom wasn't aware of it, but I did explain that it's important to have a record created for all children. Just like you bring them to a dentist, you get a set of x-rays, you have them checked periodically to prevent tooth decay. It's important to prevent problems in the spine before they develop. Well, the mom was under the impression that it wasn't important. She didn't have any symptoms. She didn't have any problems. But as I always educate my patients, the absence of symptoms doesn't necessarily indicate the presence of health. And so I kept telling her that sometimes these patterns run in families. Well, about 6 months later, the little girl started having chest pain, shortness of breath. Her back was tight. So I was able to get the x-ray, and this is what we found. We found that she was actually developing a scoliosis, and this could have been prevented if it was caught earlier. Now, thankfully, she was 7 years old, so we caught it before the growth spurt. And when I started adjusting her, got her under care, we did a post x-ray a month later, and this is what we found. Perfectly straight spine. How is it possible to completely correct a child's spine in just 4 weeks? From this, well, number one, their problems haven't been there very long. And number two, there's no degenerative disc disease. They heal up very, very quickly. And so that's the greatest gift that we can give our kids, to make sure that they just don't sit home and develop the same problems that we came in with. Well, adults, we can't get back to 100%, but kids, we can. And with that comes a massive responsibility that we take this education and we apply it appropriately to our families if we want to be at our 100% God-given potential and not 1% less. Does that make sense? Hopefully it does. So scoliosis, sometimes it gets so bad, so fast, it'll make your head spin. I've had patients come in with these Harrington rods, and when it gets to that point and there's already surgery, there's not a whole lot I could do except work around the hardware. These rods, screws, bolts, they all, it's a 100% failure rate at some point. So these surgeries have to be redone. The younger the patient, the more frequently and often they have to be redone. And it definitely shortens the patient's life expectancy. We can improve quality of life, but we cannot alter where that surgery has been done. So again, the only way to prevent this is to have children and young ones checked as early as possible. Just always remember that the absence of symptoms doesn't necessarily indicate the presence of health. Just because there's no symptoms and a person feels good, it doesn't mean that they're healthy on the inside. And the only way to know is have a proper evaluation, a consultation, examination, and x-rays if they're appropriate, thermal scan. We do a full workup and give a checkup and make sure that we have a clean bill of health. And if not, hopefully we've caught it early enough to nip it in the bud. And if we can nip it in the bud, then the question is, what is that worth? What is it worth to prevent sickness and disease rather than to treat it? We all know what the cost is to treat these things, not just financially, but mentally, spiritually, emotionally. It bankrupts people and it bankrupts families. So prevention is the key. Be consistent with your health regimen. Be consistent with your home care. Every visit builds on the next. In the first 4 to 8 weeks, your adjustment's only going to hold 24 to 48 hours. That's why we do a progress evaluation after 4 weeks to see where you're at and see if you're ready to go on to the next phase of healing, and also after 8 weeks as well. And if you miss an appointment, it's not just the home care that needs to be done twice a day. Your adjustments need to maintain consistency as well, because if you do miss a visit, it throws your body rhythm off. And that's what causes relapse and delays the appropriate healing that we anticipated for your care to play out as we had hoped. So if you miss a visit, sometimes life happens, but it's absolutely critical, crucial, vital that you make that visit up within 24 hours. Let's talk about the major premise. There are certain laws when it comes to health and healing. These laws are immutable and unchangeable. And one of these laws is called the major premise. And it states that there's a universal intelligence in all matter, continuously giving to it all its properties and actions and maintaining it in its existence, and gives this intelligence its expression. So let's break that down for a minute. What does that mean? There's a universal intelligence in all matter. Who made the universe? God did. And his intelligence is not just in some matter, it's in all matter. It's in you, it's in me. It's in a bird, a dog, a tree, anything that has life. It gave it life and it maintains it in existence. And that's who we are. We live our lives through this expression of intelligence. The same intelligence that created the living universe is the same intelligence that created us and expresses itself through us on a moment-to-moment basis. Now, innate intelligence is that inborn intelligence that we were given. The moment that conception occurred and God breathed life into us, when that sperm fertilized the egg, that universal intelligence that became part of us now becomes innate intelligence. It's inborn. And that innate intelligence knows how to create our body, how to take a sperm and an egg and multiply and divide the cells and multiply and divide. And on the 18th day after conception, create the beginnings of a brain and a spinal cord first, so that that intelligence has a communication system to coordinate all function and healing in the body. So the first thing to form in the human body is not the organs, the lungs, the heart, the stomach, liver, spleen. It's none of that. It's the brain and the spinal cord first, because it runs the show. And basically, it demands to know exactly what's happening here in every cell, organ, and tissue, so that it can keep everything functioning and healing at all times. So that innate intelligence knows what the body needs, where it needs it, when it needs it, how much of it needs. And we know that because that's the intelligence that actually made your body. When you cut your skin, it's not the Band-Aid that heals, it's your body that heals. It's innate intelligence that heals from the inside out. When you break a bone, innate mends that broken bone, not the cast. So if your body's smart enough to make you, that intelligence is smart enough to heal you. And the character of such innate forces was never designed or intended to injure or destroy the structure in which it inhabits. And that's a law. And so some of these innate forces we perceive as bad, and I'm here to tell you today that they're not bad, that most of the time these are the pathway to healing, that these symptoms are actually the cure. Think about a cough, sniffle, sneeze, flu. Even Johns Hopkins University said that that's the way that your body expunges or expels foreign debris, bacteria, viruses, all the junk. It's trying to get it out. And so we think that this is bad. So what do? We actually hold it back, or we shove it back down there with Robitussin. We try to shut off the symptoms when in fact, those symptoms are actually the pathway to healing. Another great example would be if you ate a bad piece of chicken, or you had food poisoning and your body starts to vomit or have diarrhea. Again, are those symptoms good or are they bad? Well, our first thought is, well, they're bad and we need to take something to shut them off, right? We need to take Pepto-Bismol or Mylanta, shut off the vomiting, shut off the diarrhea. Well, if you shut that off and that poison stays in your gut and your system, are you healthy or unhealthy? Right? That's the question that needs to be asked, because if you don't have those symptoms, getting rid of the poison, that's really going to make you sick. So in fact, the vomiting and the diarrhea, those symptoms are actually the cure, the pathway to your healing. Those symptoms were never intended to injure or destroy you, because innate made you, innate knows how to heal you. Same thing with a fever. At 102 degrees, bacteria die. You let the fever go to 103 degrees, viruses die. The body temperature, that elevated body temperature, slows down those microbes so that the white blood cells in the immune system can be effective in killing them and eliminating them. If you bring the fever down, you're stopping that process of healing. At 104 degrees, your body makes something called interferon, interleukin. And what is that? That's something they give to people in hospitals who have AIDS and cancer, a powerful immune system booster at the cost of thousands of dollars that's made synthetically by a drug company. Your body makes by itself. Innate intelligence generates that if you let the fever go over 104 degrees. Did you know that? That's why I've never given my children, any of my children, when they were younger, any fever-reducing medications. I let the fever run its course. I bundled them up, and I allowed the process to unfold the way it was supposed to, let the body heal itself. I always adjusted them, kept them well hydrated, and never had to take them to a pediatrician or a hospital because of a fever or an ear infection or anything like that. I always try to work with the intelligence. I always try to work with innate intelligence instead of against it, because these innate forces, these symptoms, were never designed to injure or destroy the structure in which it inhabits. And that's a law. So just remember, the symptoms are the cure. The symptoms are the cure. It's a different way of thinking. You may have thought of this differently because of how many drug commercials we watch, or listening to what other people say or what other people do. But that doesn't mean that it's right. Once you understand how the body works and that healing comes from the inside out, you start thinking differently. And if you do, you make better decisions. And if you make better decisions, you get better results. And that's what you're here for. So let's look at what happens when there's interference between the brain cells and the tissue cells. So if you look at this, you'll see a feedback loop, and the brain is always sending messages out to the tissue cells. The brain is always sending out messages to the heart cells, or to the pancreatic cells, or to the digestive cells. And those cells have to send messages back to the brain to tell the brain whether or not it's doing what it needs to do, or there's a problem and the brain needs to make adjustments. And then it sends those innate forces out to make corrections. But if you have subluxation, if there's a bone out of alignment in your neck or your back, what is it doing to the spinal cord or the nerves? You know what it's doing. It's interfering with it. And while it may or may not be causing your neck or your back pain, if it's shutting down vital nerve supply to these tissues, now then the tissues aren't functioning at 100% any longer. If there's interference here, and University of Colorado showed that the weight of a dime can actually reduce the nerve transmission by 50 to 60% in just 3 minutes. And now this tissue cell is only getting 50% or 40%. If this tissue cell is a heart cell, is that heart cell, or the muscles in the heart, because they're only getting 50% nerve supply, are they going to be able to properly eject the blood with the right force to get the oxygen and the nutrients out to the distal parts of the body? Maybe not. And because of that, what is your body going to have to do to compensate? Because of this subluxation, because of the interference and the weakening of the cells and the tissues because of the subluxation? Well, maybe it'll raise your blood pressure. And if it raises your blood pressure, well, then you have another symptom, right? And you go to the doctor, you have this pressure in the back of your head, and he says, oh my gosh, your blood pressure is off the charts. We're going to give you these medications. Did that correct the cause of the problem? No. All it did was fed your body a cocktail of lies, pharmaceutical cocktail of lies, which basically brought your blood pressure down and fooled your brain into thinking that there's no more problem at the level of the tissue cell. So the cause of the problem still remains. You still have damage at the tissue cell, but you've masked it with medication now, and we more comfortably allow our body to degenerate and move toward a state of early death. And that may sound rough around the edges, but if you look at this picture, that's basically what we do in our healthcare system. As we get older, we have more health problems. We have subluxations and levels of interference in our neck, our back, our spines are messes. We're not getting 100% nerve supply. We don't have 100% function going to the cells and the tissues. People aren't educated to look for that. And because of that, we have neurological breakdown, neurological weakening, and we try to supplement that with medication. And we're on 2, 3, 4, 5, 6 different medications, seemingly having our blood pressure and our blood sugar and our cholesterol and all these things under control. And our bodies aren't functioning at 100%. So again, what's happening here is something that is fooling us into thinking that things are under control, and they're not. We're still silently functioning less and less, more poorly, developing disease, treating it with more medications, and maybe living longer, but really dying earlier on the inside. And so this is a snapshot and a picture of what our healthcare system does. It's the standard of care. People are living longer, but they're not living healthier. So they're just, as we get older, we take more medications, and then we have to take more medications for the side effects of those medications. We're living longer, but with less quality of life. And if you want to correct the picture on this, now that you have an understanding, if you want to reduce, get off some of these medications and try to live your life raising and elevating function? Well, first and foremost, you have to correct the cause, the source, and the root of why the body is weakening and not functioning at 100%. Correcting subluxations means not just getting out of pain, getting the pressure off the nerves to get out of pain, but restoring proper nerve supply, allowing innate intelligence to flow freely at 100% to every cell, organ, and tissue in the body so it can repair and regenerate at its God-given genetic potential. And then once you do that and things start restoring and returning to normal function, well, one example that I just saw in one of my patients is who was on blood pressure medication. He's getting adjusted for 4 weeks and his blood pressure is going too low. And so now he just completely got off the medication, went back to the doctor. Doctor said, yeah, you don't need to be on the medication anymore. And I told him this would more than likely happen many weeks ago. And in fact, it did, because we corrected the cause of the problem, which was in the upper part of the neck. And he didn't even come in as a chief complaint with neck pain. I found it, and his goal was to not just get out of pain, but to get healthy. And so we corrected the subluxation, and he eliminated the medication. And now that he's got 100% function in the brain, 100% function in the tissue cells and his organs and his heart. And he's on his way to a happy, healthy future and a happy, healthy life and retirement. And that's what his goal is. Thomas Edison said the doctor of the future will interest his patients in the care of the human frame and diet and in the cause and prevention of disease. So if you want to learn more about this, about how to prevent disease, life extension, anti-aging, I want to urge you to register for the upcoming workshop here, this anti-aging and detox workshop. You'll learn all of this and a whole lot more. There's so many other strategies that we'll talk about. How to eliminate interference from your nervous system, eliminating all the different levels of interference from innate intelligence so you could be at 100% of your God-given potential. If that's you, make sure you get up from the seats right now or walk over to the front desk, register for yourself, your friends, your family members, loved ones. It's going to be an amazing workshop, anti-aging and detox. You learn how to improve your sleep, look and feel 10 to 20 years younger, increase your energy, how to help your body release fat, cleanse your body of disease-causing toxins. It's going to be all this and a whole lot more at this upcoming workshop. So let's get you registered now. And thank you for joining me this morning. I love and appreciate you. God bless.